Toothbrushes. What is a toothbrush designed to do? Toothbrushes are designed to remove debris from the surface of a tooth. Toothbrushes date back to 1600 BC. Originally, they were twigs or sticks cut from tree branches. The ends of the branch were frayed by crushing the fibers to make bristles similar to the toothbrush bristles we see today. Modern toothbrushes are used in much the same way. They remove debris and plaque from the surfaces of teeth and gums. They also stimulate the gum tissue to keep it pink and healthy. There are many different kinds of toothbrushes. Bristles can be flat or crossed, hard or soft. Brushes can be manual or electric. The question is, which is the most effective at removing plaque? There are many scientific studies looking at the efficiency of toothbrushes, but there is little evidence to prove that one model of a manual brush is more effective than another. There is some evidence suggesting that, when used properly, certain electric toothbrushes can be more effective than a manual brush at removing plaque. To be effective, a toothbrush should be durable, flexible, easily manipulated, and easily cleaned. It should have a lightweight handle and strong bristles that are not too rigid. Most importantly, it should meet individual requirements. Not all toothbrushes are appropriate for all people. There are a number of influencing factors to consider when choosing an appropriate toothbrush for a resident. What is their ability to use a toothbrush effectively? Do they have a physical condition that will impact their ability to brush, such as a problem with mobility, manual dexterity, or vision? Are they motivated and willing to do their own care? It is always best to use a soft or ultra-soft toothbrush. The gums of older individuals are often tender and can bleed easily, especially if they are already showing signs of gingivitis. Softer toothbrush bristles are more effective in cleaning the area close to the gum line. This is the area where the gum meets the crown of the tooth. Soft bristles are gentler on the gum tissue and will reduce the chance of gum recession and toothbrush abrasion. The prolonged use of a brush with harder bristles can cause the tooth enamel and dentin on a tooth's root surface to wear away. This can cause the crown of the tooth to weaken, resulting in abrasion and sensitivity. It may be necessary to use a child-sized toothbrush for residents who have difficulty opening their mouths wide or have small mouths. Children's toothbrushes have smaller heads and smaller handles. Smaller handles can be good for residents with small hands. A Collis curved brush is specially designed so that the bristles are curved. These curved bristles surround the tooth. This is meant to allow both the inside and outside surfaces of the teeth to be brushed at the same time. These brushes can be especially helpful for residents with limited dexterity or for care staff attempting to brush the teeth of a more resistant resident. Specialty grips can be custom made to meet the needs of individual residents. Some examples of specialty grips include a rubber bike handle. This provides a better grip for residents that don't have good manual control. A tennis ball. This is good for residents that cannot grasp the small handle of a regular toothbrush. Long-handled toothbrushes are also available for residents that cannot fully bend their arms. Suction toothbrushes attach to the suction machine and allow the care provider to brush a resident's teeth while the suction works to remove any debris or saliva as they brush. This type of brush is ideal for residents who have difficulty swallowing. An electric toothbrush is a good alternative to a manual brush, especially if the resident has physical limitations that affect their ability to brush. Electric toothbrushes should be used for at least 2 minutes. Many have built-in timers. There's no need to apply pressure on the gums or teeth when using an electric brush. It is designed to do the work for you. Technique is still important. If the bristles are not placed properly on the gum line, the gums can become irritated. It is important to read the directions before using an electric brush, as they are all designed slightly different. Some research has shown that electric toothbrushes can be more effective than manual brushes when used properly. There are a number of reasons for this. Oscillating, rotating technology can easily loosen and sweep away plaque. Electric toothbrushes have higher speeds and motions that cannot be reproduced using a manual brush. They have larger handles that can be good for some residents. In recent years, electric brushes have become lighter and more comfortable to use. Residents should have a toothbrush for their teeth and a different toothbrush or denture brush for their dentures. Toothbrushes should be replaced every 3 months unless the resident has been sick. A toothbrush should be replaced immediately following an illness to ensure that the resident is not re-exposed to the bacteria or virus associated with their illness. Always replace a brush that looks worn or frayed. Brushing technique. Positioning. Care providers should practice proper positioning when attempting to brush a resident's teeth. Good positioning will minimize stress and strain on the care provider's back, neck, and joints. If the resident is sitting, the care provider should stand beside or slightly behind him or her. The arm is then wrapped around the resident's head, and the care provider can lean over slightly to see in the mouth. The care provider's hand is stabilized by resting it on the resident's chin. With this hand, the care provider will then gently pull the resident's lips open. Taking this position slightly behind the resident will provide better access to the resident's mouth than positioning beside or in front of the resident. However, if the care provider feels any stress or strain on their back, neck, or joints, they should change positions. If the resident is in a wheelchair, you may be able to tilt the chair back. If the resident is lying in bed, you can sit or stand beside their head. This allows for greater visibility and less strain on the back, neck, and joints. Standing beside or behind the resident may not be appropriate when caring for someone with dementia. This may impede their ability to see and anticipate what is happening. In this case, you would want to position yourself in front of the resident. Brushing. The effective removal of plaque depends more on the brushing technique than on the brush itself. There are many different methods of toothbrushing. The technique that is most widely accepted by dental professionals is a method that is meant to effectively remove plaque with minimal trauma to the teeth and gums. It is easy to learn and apply. Hold the toothbrush handle in the palm of your hand with your thumb against the handle. Make sure your thumb is close enough to the head of the toothbrush that you can manipulate it with control. Direct the bristles towards the resident's gums. Place the bristles partly on the gums and partly on the tooth surface. The brush should be at a 45-degree angle to the tooth. Gently vibrate the bristles and roll slowly, moving the bristles from the gums towards the top of the tooth. Slowly count to 10 as you do this procedure. Repeat these steps up to 5 more times in the same area. For the front teeth, position the brush on its end and place the narrow end of the brush head 45 degrees to the gums and teeth. Vibrate and roll as described previously. Brushing sequence is also important. This ensures that all areas of the teeth and gums are brushed. Start from the same place each time. A good starting place is the outside of the teeth in the upper molar region on the right side of the mouth. From here, move the brush around the mouth to the left side. Repeat on the inside of the upper teeth and on the inside and outside of the lower teeth. Brush strokes should constantly overlap the previously brushed area. If a resident is resistant to oral care, Try to brush the areas that are harder to access first. For example, starting on the inside of the teeth. It is important to brush for approximately 2 minutes to effectively remove all the plaque. There are different methods you can use to time brushing. You can count to 10 on each stroke or use an egg timer. Some electric toothbrushes have built-in timers. A more creative way to time toothbrushing would be to listen to a song while brushing. Listening to one of the residents' favorite songs may make this process more enjoyable for them. The timing of brushing is also important. Brushing after a meal is ideal to remove food debris. Brushing before bed is encouraged because any bacteria and plaque left on the teeth will thrive during sleep. The mouth tends to be drier during sleep, so the teeth are not protected by saliva's natural cleansing ability. The longer bacteria remains undisturbed on the teeth, the more damage it can cause. The recommendation to brush the teeth at least once a day should be considered the absolute minimum. If it is possible to brush more often, such as after a meal, then this should be done. When teeth are brushed only once a day, due to a resident's resistant behavior or significant disability, it is extremely important that plaque removal is thorough. Plaque houses the bacteria that cause dental disease. Removal of plaque is the only way to minimize the risk of dental disease. In certain situations, such as when someone is extremely debilitated or in the later stages of palliative care, brushing may not be the best choice. In these situations, brush aids are available to assist in the removal of plaque. The care provider can wrap gauze around their finger and wipe plaque from the tooth surface. Baby finger cots can also be used on the gums. These are rubber finger cots that have an irregular surface to allow stimulation of the gums. These options should not be used for people who are demonstrating resistant behavior, as there is a risk that the care provider's fingers could be bitten. Toothettes, mouth swabs, and oral cleansing swabs are all in the same family of products. They are commonly used in hospitals and long-term care facilities in place of a toothbrush. These products should be used with caution, as they have been shown to have limited cleaning abilities, especially for removing plaque from the teeth. They are most appropriate in applying moisture to the mouth or for removing large particles of food debris that may be pocketed. A toothbrush is the safest and most effective way to clean and stimulate the oral cavity. Glycerin swabs are no longer recommended due to their high acidic levels or low pH. For example, lemon glycerin swabs have a very low pH. Any product with low pH can increase the risk for dental decay, enamel erosion, and can irritate the mucosal tissues within the oral cavity. Swabs without glycerin or lemon are available and provide a better alternative for moisturizing the mouth.